of the Connecticut Advisory Council for Victims of Crime. So this is sort of a combination of our advisory council meeting. We're also members of the stakeholder groups. So we are officially today the Victim Needs Assessment Stakeholder Meeting. And we're anticipating that we will now get the results of the victim needs assessment, which we have been following through. The council has followed through for the last number of months. So before we start, two things. One is that this program is going to be live streamed on the YouTube channel. So just so you know that. And secondly, if you haven't already, if you want to check in on the chat and just sign in so that Jane, who's our wonderful staff person, to our council can make sure everybody has been noticed as being present. Okay, so with that, I am going to turn it over to Patrick Madden to start the results that we're looking for.
Great, thank you very much. Happy to be here today. Adam, I don't know if you wanted to say a few words while I tried to pull up this presentation.
I can definitely do that, Patrick. Good afternoon, everyone, and welcome to this presentation of the 2021 Connecticut Victims Experience Survey Research Project. I'd just like to introduce the MDR research team and presentation team. Patrick Madden, President of Market Decisions Research, as well as Dr. Cecilia Stewart and Qualitative Research Manager Allison Tipperary will be leading today's presentation. Thank you again for the chance to conduct this interesting and important research, and we really are excited to present these results to you today. And with that being said, I will hand things over to Patrick.
Great, thank you so much, Adam. So again, as Adam mentioned, we are really happy to be here today as part of this process and speaking to you. It's been a bit of a long journey. We've been doing this for over a year, conducting this really comprehensive assessment. But by and large, this is sort of, for me anyway, it's sort of the most, both the most fun and rewarding part of what we do, actually getting to sort of talk about the results, what it means, and then what to do with it. And that's ultimately why we're doing this thing. So we love research, but we love more actually using it to do good things and actually improving the policies and the services that we actually are conducting this research for. So this is a really valuable part of the process, and we're so happy to be with you here today. And this was totally a group effort, not only internally here at MDR, but also working with OVS as well as the Advisory Council to provide input into the design and implementation of this needs assessment study. So I'll start things off and then I'll hand it off to a few of my colleagues while we go through the data. We hope to do about 45 minutes in the presentation. There's a lot of information here. More than we could possibly get to in one meeting or you'd be interested in sitting down to listen to. But we'll give you an overview of what we found over the next 45 minutes. Linda might follow up, I believe, with sort of some takeaways and next steps in terms of what these data are being used for. And then, of course, hopefully we'll leave time for any questions or comments that anybody has about this assessment. We'll be happy to answer any questions. And then, of course, we're going to be following this up with a more comprehensive report that should be released soon. So as well as other deliverables as well. So anything that isn't necessarily presented in here, we should have plenty of other comprehensive documents to sort of go over everything that we found as part of this research process. First, just want to acknowledge that this study is an effort by OVS to better understand the types of victimizations experienced, the services utilized in Connecticut, as well as examine the aspects of underserved communities where crime may exceed the service capacity and leave victims unsupported. Also, it's really important to recognize all of the input that went into this. And again, we wouldn't be here today with this data if it wasn't from the participation of victims and service providers in the state of Connecticut. So we really just want to thank everyone who participated as part of this process, provided their input, oftentimes took a lot of courage and bravery to talk about their experience, which is also often a difficult thing. But it's really important, and these candid responses and information provided really provides a unique insight into crime and victim services in Connecticut, and really allows, it's a critical aspect for ultimately improving victim services and policy in Connecticut. So again, thank you to everybody who was a part of the process. So at a high level view, why are we here today, right? So this is really Connecticut's first statewide comprehensive victimization needs assessment. And the goals laid out from us from the start of this process was really one, to establish a statewide baseline for crime victimization, sort of underline the word baseline. Hopefully this is the start of an ongoing process where, every several years the state can revisit this and get updates in terms of what's going on in the state, and hopefully start to measure progress that has been made since this initial baseline assessment. Number two, understand the barriers that prevent victims from receiving services, particularly those in historically underserved communities, which again can both represent sort of more urban areas of the state and more rural areas of the state that for sometimes very different reasons have additional barriers or lack of access to certain types of services. And number three, provide a focused understanding of victims' needs so that limited funding, of course, can be directed in ways that matter and mean the most. And as I mentioned, it's been a long, wild ride. It's been a long process. So we started this over a year ago at this point. Many of you were at the initial kickoff meeting where we met with the advisory council back in April of 2021 to really talk about the assessment and start with the design process to plan everything out. Over the course of the past year, we've conducted a victim survey back in August, starting in August of 2021. We followed it up with some in-depth interviews with victims of crime, starting at the end of last year, 2021. And just in April of 2022, finalized everything with focus groups amongst victim service providers. And now June, finalizing everything with sort of a cumulative report, as well as some other deliverables in this presentation today. Briefly about the methodology, I don't want to get too bogged down into the details here, but in terms of the actual survey itself, we spoke to a little over 1,200 adults across the state of Connecticut who had been a victim of crime at some point in their lives. The way we collected the data, we mailed out letters to randomly selected households across the state. We also conducted an online sample and combined those two things to get the 1,200 completed surveys. The survey itself contained topics including things like client crime experience, the services they received, or in some cases didn't receive, barriers, and the impacts of the victimization experience. The survey itself was conducted from August to November of 2021. And just want to stress that the survey was voluntary. Participants were able to withdraw at any time from the survey if they weren't comfortable with it, or within the survey, they could skip any question that they did not want to answer. And that was an important thing. Following it up, there was actually a question at the end of the survey where we asked participants if they were interested in potentially participating in a more in-depth interview about their experience. And from that pool of survey respondents, we eventually recruited 39 additional in-depth interviews. And this allowed us to collect sort of more in-depth information on some of the topics that had started popping up in the survey about barriers, certain barriers that were being experienced, services, et cetera. So really dive more deeply into a lot of those experiences, collecting more detailed information on services, barriers, challenges, as well as opportunities for improving the experience. And again, as I mentioned, those were conducted from October just to the beginning of January 2022. Finally, the focus groups with service providers. Again, service providers who work with victims of crime in Connecticut. We kept that definition very broad. Again, we wanted to be quite inclusive of the entire experience. So it included participants from mental health services, law enforcement, legal services, substance use services, housing facilities, community centers, child services, domestic violence, education, human trafficking, and other types of social services. So again, throughout this whole assessment, I think one of the key points and the issues we wanted to try to make sure of was that we were collecting information from a wide and diverse range of people across the state. So it ended up being a total of 5 focus groups with 25 participants total in various areas of the state. And those, again, were conducted in April of this year. I don't want to spend too much time on the demographics of who participated in the assessment because I do think there are more important findings, more interesting findings to talk about. But I think I wanted to sort of highlight one key point when it comes to, who we were speaking to for this assessment. And we really deliberately tried to, again, as I mentioned, collect information from a representative and diverse group of respondents. So these are results from the survey. The red bar is the actual survey participants, unweighted, and the gray bar is the population of Connecticut from the American Community Survey. As we can see, one of the things we did is sort of mimic pretty closely the population of the state of Connecticut to the best we could. And especially when you look at something like race, typically when it comes to a process like this, particularly Black and African American respondents and Hispanic respondents are generally much less likely to respond to a survey or participate in this kind of process. And we were really deliberate in trying to boost up those numbers as much as we could, very deliberately in our design of our research. So you can see that 12% of our survey respondents were Black or African American compared to 10% of the population of the state. So again, we tried that really hard, and I think we're really proud of sort of that we were able to reflect, I think pretty accurately, the state of Connecticut overall. Here's a few tables, a lot of data here, but here's a summary of who participated in those 39 in-depth interviews. Again, I want to show we have a sort of representative mix, both in terms of age and gender, race and ethnicity, and also in terms of the types of crimes that were experienced by the participants themselves. Quick focus group overview. Again, as I mentioned, we conducted 5 total groups. We focused those on specific regions of the state and providers within those regions. Conducted those over a few weeks in April and included various counties with those groups. And finally, one thing I'll just want to say before I hand it off to my colleagues to talk about the actual the results and the interesting findings. I just want to, throughout this report, we're sort of referring to victim services. Again, we define that really broadly, any service or program that focuses on helping victims in the immediate aftermath of the crime, or that one that continues to support them as they move on with their lives. So again, we're not just talking about things like legal services and healthcare and mental health services, but also include things like, religious services, veteran services, even friends or family members can be a really support that is necessary in that process. So again, taking a really wide view on this particular topic. And with that, I will hand it off to Cecilia.
Thanks so much, Patrick. So for the next section of slides, we are going to go over survey, interview, and focus groups results by topic. I'm going to discuss the survey results with tables and graphs, and then I'll hand it over to Ali at the end of each topic to elaborate with qualitative data. So over half of the victims that completed the survey experienced violent crime victimization, followed by nonviolent crimes and other crimes. For this project, violent crimes included harassment or threats, domestic abuse or violence, physical assault or abuse, sexual assault or abuse, child sexual assault or abuse, robbery, hate crimes, child abuse, homicide, gun violence, strangulation, kidnapping, elder abuse, and human trafficking for sex or labor. Nonviolent crimes included vandalism, identity theft, fraud, extortion, or other types of financial crimes, theft or larceny, burglary, and auto theft. And other crimes included driving under the influence. And then some of our open-ended survey results elucidated some of these other crimes, and those included such things as credit card theft, injustice from police, discrimination due to disability, petty theft, and stalking. Next slide. Victims were asked about the frequency in which they were victimized. 43% of respondents overall indicated that they were a victim of their reported crime only once in their lifetime. 38 have been a victim of the crime 2 or more times, and victims of violent crimes were far more likely than others to report that their victimization was repeated or ongoing, with 33% of violent crime victims experiencing repeated victimization. Next slide. Results from the survey show that victimization occur in a variety of settings and differed by crime type. Over 1/3, or 37% specifically, of all crime victims reported that victimization occurred in their home. 16% of violent crimes were reported to occur at the home of a friend, relative, or neighbor, while 14% of nonviolent crimes occurred online. Next slide. Victims were asked about their experience reporting or not reporting their victimization experience to police. Nearly half of victims of nonviolent crimes reported the incident to police, and in comparison, only 34% of victims of violent crime reported to police, while 1/4 did not report to anybody. Violent crimes tend to be underreported to police or other entities. And among victims who did not report the crime to police, the most cited reasons were because they reported it to somebody else instead, like a family or friend, or they felt nothing could be done about their situation. Fear was also a strong motivator in not reporting crimes. Next slide.
So we started our in-depth interviews by asking the participants more about their story. We asked them, tell us more about the crime you experienced, and also what did you do right after the crime? Who did you reach out to? And one of the biggest findings we saw was that victims are extremely different. They all have different reactions, their own individualized reactions to their crime experience, whether that is reaching out to law enforcement immediately, or if that's waiting and processing what's happened before they reach out, or if it's not reaching out at all. And in this top right quote on the corner up here is a great example and imagery of the complex things that can happen right after a crime experience that one of our participants shared with us. Another key finding we saw is that 34% of our interview participants did not know where to go for help after their crime experience. That does mean there's a bigger number that did know where to go for help, but I still think it's worth noting the 34% of participants who didn't know. We also found that the participants we talked to that experienced violent crimes were more likely to delay reaching out for any help at all. And an initial finding that Adam and I have shared before in previous meetings, and it happened to ring true throughout all the interviews after all 39 of them were complete, that victims of crime and these participants had very polarized experiences and opinions and views with law enforcement. And so they were either very satisfied with their experience and treatment, or they were very dissatisfied. And those two bottom quotes, you can see the spectrum. Not only am I victimized by the perpetrators, but I'm also victimized by the police, to a very different experience of it went well, the police were very helpful, they were very honest. And we also heard from some participants that they wish that the law enforcement or police officers that were there right after their initial crime experience, they expressed a need that they wanted more immediate knowledge and training about services and resources for victims right after the crime. For our focus groups with service providers, we started the groups with a fill-in-the-blank question, which was, what comes to mind immediately when you think of a victim of crime in Connecticut? And the two most common words throughout all 5 groups were underserved and diverse. And diverse, again, is mirroring that finding from the in-depth interviews of just how different each victim is, including the needs and wants that they need after their crime experience. And then underserved is a topic that was a huge theme throughout the rest of the focus group topics. Next slide.
So victims reported where, if at all, they received information about victim services. Half of respondents indicated that no one informed them of victim services, and of those that were told about services, they were most likely to be informed by law enforcement or family and friends. Next slide. The top 5 resources that victim relied on for information about services were police or law enforcement, friends or family, attorneys or other legal representation, victim advocates, and mental health providers. Violent crime victims were more likely to report receiving information about services from family or friends, victim advocates, and mental health service providers. Victims of nonviolent crimes were more likely to be informed about services by law enforcement. And because victims of violent crime are less likely than victims of nonviolent crimes to report victimization to police, this may be why they rely heavily on other sources of information about victim services. Next slide.
So during the interviews and the focus groups, we asked about awareness of services, and a big finding throughout the interviews is that a lot of participants agree that the most important source of access or learning about services in general for victims is from professionals who work with victims of crime. Another huge topic and theme throughout the interviews was the need for service providers to follow up consistently about services. And some participants note that even if they didn't want services initially or weren't ready for services initially, that's why the follow-up is so important, to maybe at a later date they are ready for services. Another big finding about awareness is participants from the interviews agreed a multi-mode approach for awareness and access is very important. You can see in that top quote, emails, mail, in-person, even text messaging. People have different communication styles, and you never know what will catch someone's eye in how they communicate. And that's why a lot of participants recommended a multi-mode approach as the strongest approach. We also had some interview participants who admitted that they even thought that their life after the crime may have been different if maybe a first responder or law enforcement, whoever was there initially after the crime, gave them a phone number or card or some type of literature for a service option in the area. And you can see in that bottom quote, it's very short, but it illustrates that point pretty well. If you don't know what services are available, how would you know who to contact? For the service provider focus groups, they had a lot of ideas about awareness of services. One of the major themes was providing more literature in places like schools, medical facilities, and maybe other types of agencies that don't immediately come to mind. And we also had the idea in some groups that it might be helpful to hire more survivors or past crime victims to different organizations, that they may have more experience of how to reach victims of crime and how to work with them and how to communicate with them. Next slide, please.
So victims reported receiving a wide variety of services after victimization. This included anything from legal assistance to victim compensation, medical care, and mental health services. The most common services received among victims of violent crimes were assistance with orders of protection and mental health services. And many violent crime victims stated that they did not receive any services. Many non-violent crime victims did not receive any services as well, about 31%, and even more stated that they did not need services after victimization. This was about 42% of nonviolent crime victims. Of services that were received by victims of nonviolent crime, assistance with the criminal justice process and victim compensation were the most frequent, reported at 3%. Next slide. So victims were asked to deem any services that they received either as very effective, somewhat effective, or not effective at all. This graph here, the dark blue represents very effective, the light blue represents somewhat effective, and the reddish maroon color represents that the services received were not effective at all. Nearly 3/4, about 70% of respondents who received victim compensation felt it was very effective, compared to only 28% of those who received emergency shelter or temporary housing. Effectiveness of services offers an important glimpse into where exactly improvements could be made. For example, mental health services are the second most received service, but they're ranked as one of the least effective by respondents. Next slide.
So talking about received services with the interview participants, we found that with our interviewees, those that did receive services were satisfied with their experience and reported positive outcomes. And this was especially true with victim advocacy or mental health. And I did pull, again, 2 quotes on the side here with some examples. Victims Advocate Office was excellent. They kept them informed, met with them each time before court. Then we also have an example of a participant who did receive therapy after their crime experience, saying it helped tremendously. And it was just nice to have someone to help push them along and get them out of that funk. When we probed a little deeper into what were the most beneficial parts of the services that they received, some of the key factors that they talked about were good communication, which meant strong and consistent communication. Active listening was a big one, reliability, emotional and financial support. And we heard this phrase, feeling seen and heard. Participants expressed that it was so important to share their story with people that would listen and that would also believe their story as well. And then there were many victims who, again, were unaware of the services available. And then there were also some victims who received services initially, but then reported a lack of follow-up from the services that were in progress. From our focus groups talking about services, we did have a discussion asking the service providers, which services right now are not meeting expectations. And throughout all 5 groups, a lot of the service providers said they think most services are not meeting expectations and demands for various reasons. But then when we dug a little deeper, well, but which ones are meeting these expectations and demand? In a few groups, we did see that they do think crisis services are meeting demands for their clients, and they also think child advocacy services are meeting demands as well. Next slide.
So something emerged from the findings that a good amount of victims had a pretty large unmet need for services. So they voiced needing these services, but these services were not received. Among violent crime victims, 22% needed but did not receive mental health services, and 18% felt they needed more information about available resources. As we've talked about, many victims did not receive services because they simply just were unaware of them. 13% of both violent and nonviolent crime victims reported needing victim compensation or financial assistance after victimization. Next slide. So victims were asked about barriers to provide more context and information about why the services that were needed were not received. So this here is a quite comprehensive list of barriers, not fully inclusive, but it gives you a pretty good idea. And the most common barrier stopping victims from receiving services was, again, that lack of awareness about available services. 18% of violent crime victims stated that not thinking anything could be done and not knowing where to turn were reasons for not receiving services. Victims of nonviolent crimes reported less barriers to services than crime victims, but barriers still did exist. Other significant barriers were embarrassment or shame, trauma or depression, and the cost of services. Next slide.
So with barriers during the interviews, these were some of the main barriers talked about throughout all 39 interviews, and 2 that really stuck out to me is participants shared just how overwhelming it can be even thinking about reaching out for help for services, and that the stress or trauma that they're under is unbearable. And victims of all types, even nonviolent, report how much their mental health is affected after their crime experience, how difficult the transition to going back to work or school or daily life activities in general can be. So that itself is a huge barrier for reaching out for services in general. Another one that really stuck out throughout the interviews, and this is especially true for victims of violent crimes, they didn't reach out sometimes due to stigma or guilt, or again, fear of others not believing their experience, which goes back to that point of how important it was for those that did receive services when they felt like they had a professional that worked with victims with them that really listened and believed their experience. Some other barriers that interview participants brought up was cost of service, or just the lack of knowledge about potential financial compensation that they could receive was a barrier for them for reaching out as well. They didn't even know that maybe the cost of services actually wouldn't be that bad for them in the end if they just knew about the potential financial compensation. And we also heard from a few participants who had to navigate the legal system that it was difficult, and they wish they had more guidance and knowledge in general about how the system worked, and that would have helped them more throughout their experience. When we talked with service providers about barriers for them providing services and victims accessing services, 2 major themes were staffing levels and lack of funding, also high turnover with staff and how much this has been affected with COVID-19. And not only does it affect the providers, they also agree that it affects the quality and number of services available for their clients. We also heard that providers in general just wish they had more time available. A lot are overbooked, and even little things like in one group, reporting tasks have grown over the years, and even though they know that's important, it takes away some time with the actual clients.
So victimization can impact many aspects of life, from money and finances to physical health, housing, health insurance, government benefits, etc. Victims in the sample reported that their victimization impacted all of these aspects. For all types of crime, mental and emotional health was reported to be the most affected aspect of life due to victimization, and that was across both violent crime and nonviolent crime victims. Nearly 1/4 of victims indicated their financial situation was impacted by victimization, and 21% of victims reported that their ability to participate in work or school was impacted due to their victimization. Next slide. There were some differences in effects of victimization by crime type. So among victims of violent crimes, nearly 2/3 reported impacts on their mental health. 1/3 reported their relationships with loved ones were impacted. 1/3 of victims of nonviolent crimes reported their financial situation was impacted, and victims of violent crime were more likely to have their mental health and aspects of social and professional lives impacted as a result of victimization compared to victims of nonviolent crimes. Next slide. In some cases, problems that arose from victimization required specific help to that problem. Victims who reported that their health insurance was affected as a result of their victimization were the most likely to receive help with that problem, while those who experienced issues with their immigration processes due to victimization were the least likely to receive help. That's the difference between 39% with health insurance and 11% with immigration processes. Overall, many victims reported problems as a direct result of victimization, but fewer received help. Next slide.
Moving on to possible improvements, in both the interviews and the groups, we asked participants for their thoughts, opinions, ideas on how to increase awareness of services. And I pulled a couple quotes here. And one, this top quote here from an in-depth interview participant is just a beautiful quote. They talk about how important it is, again, to repetitively provide information. And they say here, you know, I didn't know about the compensation program, but who knows if they really did talk to me about it. I just have no memory of that because of the stress and trauma that I was under. So it's a great point illustrating how important it is to keep on providing that information. Another common thing was a lot of participants brought up social media related to advertising. And they mentioned that, you know, advertising in different places such as hospitals, billboards, buses, etc. So that was another major theme as well. Talking to service providers, they also say, you know, you need actual physical things ready on hand to give out to people. This person's here, like wallet size, business cards, posters, you know, the posters where you can rip something off. That was another great idea as well. We also asked about their ideas of overcoming some of the barriers they brought up. And again, with the interview participants, the actual first responders or law enforcement, whoever is there in the initial, after the initial crime experience happens, how important it is to have that information ready and be able to tell them about the resource and information available is something to overcome this barrier of victims of crime just not knowing about services. They also mentioned better training in general, especially related to mental health, and funding to social services. When we talked about service providers, at the end of each focus group, we always like to ask, you know, do you have any other final thoughts? And a lot of the groups even mention just meeting in a focus group with other social service providers was very beneficial to them, to hear and talk it out with other people who meet with and work with victims of crime. And they think that it was very beneficial in general. They also mention going to places like college campuses, going back again to that access and awareness, going to places and actually hanging up information about services available. And then we ended the interviews and focus groups. Our final discussion topic was what are some of your ideas in improving the services that are actually in place now? And, you know, again, bringing up the themes of follow through and consistent check-ins. Another interesting idea that someone brought up as an interview participant was reaching out more to the victim of crime support system, getting them more involved with the services available and the check-ins, because, you know, maybe the victim of crime isn't ready yet, but maybe the support system, just having the information more will then be available for the person whenever they are ready. We also heard from a lot of victims of identity theft during our interviews, and these people were very passionate about trying to make future crime victims that experience identity theft, try to make their experience a little easier. They mentioned even something like a step-to-step guide, just more clear guidance of what you're supposed to do in that situation. These people were very affected by it. And even someone mentioned the idea of a support group for identity theft or fraud or things like that. For the service providers, for improving victim services, there was a lot of talk about how valuable trainings are in general, and in some groups, the importance of trauma-informed care and trainings for all types of professionals who work with victims of crime. We also, I love this quote here, just having, listening to victims more, having to learn more about their stories and what they need, and that they have, they know themselves better than anyone and what they want and need the most.
The next few slides, we are going to talk about the SWOT analysis, which really does a great job at summarizing all the results from this project. So for those of you that are not familiar, a strengths, weakness, opportunity, and threats, or SWOT analysis, is a tool that provides valuable information on aspects of a business, project, or workflow through their evaluation. Strengths are the positive elements associated with the evaluated entity. Weaknesses show the components of the evaluated entity that may impede progress. Opportunities are conditions that may allow for growth, and threats are conditions that deter from growth and progress. So in this context, a SWOT analysis is helpful to understand the implications of results gathered from the surveys, IDIs, and focus groups. So many strengths were discovered in the results of this project. Most victims of violent and nonviolent crime that received services reported that they were either somewhat effective or very effective. Family and friends, community and religious organizations, and professionals working with crime victims were essential sources of connection for victims to services. For victims of crime that received mental health services, they were more likely to report improvements in their mental health and overall quality of life after victimization and over time as compared to victims of crime that did not receive mental health services. Many victims of violent crimes who engaged in advocacy services were very happy with the victim advocate support that they received. IDI participants who identify as indirect victims of child abuse or child sexual assault crimes reported very positive interactions with law enforcement. Professionals that work with victims of crime reported that those who work in children's advocacy centers were meeting the demand of serving children who are victims of crimes. And despite the challenges they faced, service providers believed that they were successful with assisting victims during a crisis. Results from surveys, in-depth interviews, and focus groups show weaknesses that exist within the provision of services. A significant percentage of crime victims, 31% of nonviolent and 40.3% of violent, did not receive any services after their crime. The most needed but not received services by crime type are mental health services for victims of nonviolent crime at 22% and financial compensation for victims of nonviolent crime at 13.5%. Victims of violent crimes were more likely to be unsatisfied with their experience with law enforcement than victims of nonviolent crimes. Victims of violent crimes express the need for police officers who work with victims to have better and more immediate knowledge and training about services and resources for victims. Many victims of crime said they received help from various victim service providers right after a crime, but noticed a large lack of follow-up after initial contact. Professionals who work with victims of crime strongly agree that services for non-English speaking victims need more focus, and that either not many exist or folks are not aware of these services. Some service providers said that reporting and data entry tasks have over time reduced their ability to provide direct services to victims. Victims of all types throughout the in-depth interviews reported significant difficulty returning to work or school after their victimization. Staff turnover is quite high among victim service professionals, and this directly impacts the quality of services and communication provided to victims. And lastly, there's a reported lack of access to legal services for both victims of violent and non-violent crime. Many opportunities for improvement were discovered throughout this project. Victims, regardless of if they access services or not, have ideas and suggestions on how to increase awareness of services. They believe that a multi-mode approach to service awareness and access is critical. Providers expressed an interest in trauma-informed care trainings. The most common feedback from participants through in-depth interviews was that professionals who work with victims of crime must continue reaching out to victims over time. Victims of identity theft expressed the need for better direction and documentation to help guide them after this type of crime. Better communication between service providers from different organizations would help to accurately direct victims to the places that they need to receive services. While many service providers said that working in person with victims is optimal in order to build a relationship with them, COVID has kind of forced virtual meetings to occur, and they found that this was actually beneficial in reaching certain populations that they were not able to access beforehand. It would be valuable for different agencies that work with victims of crime to hire past crime victims and survivors. This kind of follows a peer recovery model with substance use disorder. If you hire somebody who has gone through that experience, they're able to empathize more with the client they're serving and able to better navigate them through the victim service system. Victims express the need for law enforcement to either be properly trained about mental health services, or there needs to be additional mental health professionals present after a crime. Additional law enforcement training regarding the provision of information about available services and resources to victims is needed. To understand the full scope of victims and service providers' perspectives, it is important to understand threats. So certain types of victim services were not perceived as helpful to victims due to communication barriers, lack of clear timeline for receiving services and next steps, as well as judgment. Many victim service providers stated that staff shortages, lack of funding, and COVID have created an environment in which service availability cannot meet demand. Victims who experienced violent crimes were more likely to delay reaching out for help or services, which puts them at increased risk for effects of victimization. Victims said the amount of stress that they were under was sometimes unbearable, and the thought of even researching service options was overwhelming. Victims, especially those of violent crimes, often do not reach out for services due to stigma, guilt, shame, embarrassment, and fear of others not believing their experience. IDIs revealed that this was especially true for women who were victims of violent crime. Funding and staffing issues not only affected victims, they also affected the professionals that work with victims. Many focus group participants shared stories about working long hours, mental health struggles, trauma, and the difficulty of their jobs. The SWOT analysis provided a valuable summary of the landscape of victim services and victims' needs in Connecticut. Using this information, literature on victimization and crime, and suggestions from interviews and focus group participants, the following are valuable recommendations to increase awareness and effectiveness of victim services across the state. Awarenesses of service is the first aspect that participants express the need for improvement. IDI participants mentioned the use of social media, email, and postal mail to inform the public of victim services. Additionally, participants stated that while they have seen some advertising for victim services in community buildings and in spaces such as hospitals, clinics, buses, and billboards, broadening this type of advertisement's reach could help be helpful in spreading information about services to those in need. This may be particularly helpful in ensuring certain demographics are aware of services. Placing advertisements in Asian grocery stores, churches with large Black or African American parishioners, or in coffee shops frequented by the LGBTQIA+ communities are just some examples of how to reach a particular demographic by meeting them where they work and live. Additionally, promotion of Connecticut's network of care was something mentioned in the focus groups that will not only increase awareness of services, but also connection to services. Another common theme that emerged was that victims heavily rely on police and law enforcement for information about necessary services.
God, that big.
Sorry, can I just ask that everybody has their microphones muted? I can just thank you. This knowledge transfer often occurred at the scene of a crime or as soon as the crime was reported, a time when victims are often not in a space to receive and retain information. Because of this, victims' knowledge of services was limited to law enforcement's knowledge of services. While some police departments have in-house victim services, many others lack the time and expertise needed to provide victims with connections to appropriate services. Trauma-informed training with law enforcement officers is a promising technique to increase the recognition of victimization by officers and the ability for officers to refer victims to appropriate services. Victims and service providers express the need to improve communication and collaboration. Literature shows that collaboration between various types of providers is linked with increased awareness and understanding of resources, as well as increased service effectiveness. Service providers in focus groups highlighted that when collaboration between mental health practitioners and law enforcement occurred, outcomes were very positive. Given this information and survey results, that showed many victims receiving service information from law enforcement, it may be helpful to integrate mental health clinicians into law enforcement departments to respond to calls with known mental health components and address potential aftercare. Many police departments across the country have adopted this practice, and research shows that doing so increases direct access to victim services and service utilization. The Connecticut Network of Care, which was mentioned for use by victims, may increase networking across providers as providers are able to create profiles and collaborate. Communication between service providers and victims was also something cited as problematic in receiving effective care. Many victims stated the need for increased communication from providers and a clear understanding of next steps. This could be mitigated by a standardized follow-up or communication schedule created by either OVS or providers. This schedule could provide victims an outline of what to expect moving forward in terms of communication, guidelines for accessing additional services, or display a timeline of upcoming communications, all of which may help address the concerns that victims voiced about lack of follow-up and short length of care, while also holding providers accountable for this schedule. Funding was repeatedly mentioned, especially by victim services providers, as a major barrier to providing victims with the services and resources that they need. Many providers specifically mentioned the Victims of Crime Act, VOCA, as essential in funding victim services. VOCA houses funding generated from criminal fines and fees and has historically been instrumental in providing precious funding to victim services. Of recent concern is that VOCA funding has been cut due to funds being deferred to the general treasury. Given that OVS is responsible for distributing this funding, supporting efforts to ensure criminal fines and fees flow into VOCA and not the general treasury is essential. And with that, I'm going to hand it back over to Patrick. You're muted, Patrick.
Thank you, Cecilia. I was following your advice, muted myself. Thank you for presenting, as well as Allie. So yeah, that sums up the overview of the needs assessment, as well as our recommendations coming out of it. And again, this is, I think a really critical part of the process. So I definitely appreciate all of your time listening to us. And I think, if I remember correctly, Linda, you'll sort of take it from here, and then we can certainly open up the floor for any questions after that.
Thank you, Patrick. Good afternoon, everyone. As Patrick said earlier, it's been a long time in coming, and I want to thank the MDR team members for their hard work and collaborative spirit in joining with OVS to complete this first Connecticut victimization survey. Again, as Patrick mentioned at the beginning of the presentation, the results from this project provide us with a baseline information and insight into crime victims' experience and perceptions of their victimization. It is my hope that the judicial branch, on behalf of the Office of Victim Services, will conduct subsequent surveys to deepen our understanding of victimization in Connecticut, and therefore allowing for the development and refining of our already effective service delivery system in Connecticut. As Patrick discussed and Mary will discuss, the results of the survey provide us with information regarding victims' experience, but also the rate of reported and unreported crimes. This information is important as it provides a look into the amount of crime in Connecticut that is not reported to law enforcement and of which we as service providers are seeing the results. We're seeing so many folks who have not reported their crimes. I wanted to take a minute and because one of the things that the survey has allowed is for OVS to look at our service delivery versus the individual who participated in the survey and the American Community Survey. So I took the survey data, the ACS data, and the data from the two of our recent fiscal years for our compensation program and our sexual assault forensic examiner program. Unfortunately, I was not able to include data from our Victim Services Advocate program due to issues related to a woefully insufficient data collection system. But hopefully within a year or so, we will have that data up and being able to compare. But really looking at who OVS is now and who are we providing services for. So when I looked at the victim compensation program, the majority of claimants are women. So 63% of the individuals who, 63% of individuals who apply for compensation are females. And when you look at the data provided by MDR, you can see that there's 52% of Connecticut residents are females. So we're a little overrepresented there. And yet 30% of our claimants are males versus 48% of the general population. So we can see where we have some work there. In our sexual assault forensic examiners program, women as patients who report to an emergency department due to sexual assault are vastly overrepresented. 93.4% of the individuals who've utilized our safe services are females, compared to 3.6%. Yet these statistics align with national statistics that report that 91% of all victims of sexual assault are females. And then when you look at the work many of you do in collaboration with us through the VOCA grant awards, 77% of those receiving community-based services are females, compared to 20.5% of males. So we're close, but we still have, I think our findings, our demographics are really reflective of some of the information that is borne out in the data that the MDR team just presented. As far as race, I thought this was very, very interesting. Again, this is our compensation program. 28.5% of claimants in our compensation program identify as white versus 69% of the demographics in Connecticut. For 20% of claimants identify as Black or African American versus 10% from the American Community Survey. Hispanic claimants, 22% of our claimants are Hispanic versus 15% of the American Community Survey, and Asian represent 0.015 of our claimants versus 5% in the ACA. So when stepping back and looking at that, we have made great, and I feel we have made great inroads into the underserved communities. And we have been able, through our compensation program, we can still do better. And that Mary will be talking about our future work, but we are addressing the needs in a way that was actually greater than I had anticipated. Excuse me. As a kind of where we are now and where we're going, we have put together, Mary and I have put together an implementation team. We met for the first time in June. We reviewed our statutory responsibilities, how our programs and services have grown over the years to continue to meet crime victims' needs, and we begin to develop our implementation plan. The team will meet again to continue our work on July 12th. In addition to providing OVS with a treasure trove of information, the results of this project will serve as a blueprint to move forward into the next phase of OVS being the state's lead agency dedicated to providing services to victims of crime. During the next 2 years, that'll be 2023 and 2024, OVS will recognize several milestones. First, it will be new leadership. Most of you know I will be retiring the end of next April after 23 years of service to the Office of Victim Services. So the second is that in 2023, OVS will be recognizing our 30th anniversary of being transferred into the judicial branch from the executive branch. 2023 also marks the 45th anniversary of the legislation that created this agency, which we were called the Commission on Victim Services back then. And then 2024 marks the 45th anniversary of our starting to provide compensation assistance to victims of crime. So within a 24-month period, we have many opportunities to highlight the work that you do as service providers, that OVS does, and to really capitalize on the information that has been provided through this project. And OVS has a long and proud history of providing services to victims of crime in Connecticut. The results obtained from this baseline project, and again, hopefully future surveys will provide much needed information to us and you, our stakeholders and our partners, as we continue together to meet the evolving needs of crime victims in Connecticut. So those are just my kind of where we've been. And now I'd like to turn it over to Mary Kazicki.
Thank you, Linda. As Linda mentioned, we view this as a baseline survey, and the opportunities that have been identified through this baseline survey will serve as a guide as we begin to capitalize on the strengths that were identified and begin to address some of the current challenges that were identified in the provision of victim services in Connecticut. At our initial implementation meeting, one of the first priorities was to conduct a comprehensive review of our publications and communications. The importance of trauma-informed responses to victims of crime was a consistent theme that was identified through this needs assessment. As our language has evolved, we want to ensure that our publications and our written communications are reflective of consistent and trauma-informed language. Accessibility is another consistent theme that was identified, and we will also be reviewing which publications have yet to be translated and move those requests for translation forward to increase accessibility for our non-English speaking victims. As we've heard this afternoon, a lack of awareness of services has also been clearly identified. We know that each victim's response to trauma is as unique and deeply personal as the facts and circumstances of each victimization. We also know that a victim's decision to engage in services and when or how to engage is informed by a multitude of factors. What must be a priority is to remove lack of awareness of services as one of those factors that informs victim engagement. When asked about opportunities to increase service awareness, victims repeatedly offered suggestions that law enforcement provide a small card with information on available resources at the time of victimization. This offers insight into several opportunities to improve awareness of services. Law enforcement officers do, in fact, provide that information when they interact with a victim of crime. So this is an opportunity to continue to highlight the importance of providing that information and also to review the format of the information that is provided to improve its functionality for victims who are experiencing trauma following a victimization, because we know that trauma impacts the brain's ability to process information. We also heard that consistent follow-up and repetitively offering information at each interaction with a crime victim would be helpful from the victim's perspective, and that may help to combat the inability to efficiently process information. We know that many crime victims do not report their victimization. In fact, the data revealed 60% of the victims that participated in the survey did not report their victimization to law enforcement. Given this statistic, we need to identify additional avenues to increase awareness of available services. Victims and service providers offered many possible avenues to explore, including multiple social and written media platforms, and engaging with non-traditional organizations that interact with victims in their daily lives, not just when they're possibly seeking services related to a victimization. Another barrier that was repetitively identified, particularly for victims of violent crime, is the stigma associated with being identified as a victim. Victims spoke candidly and eloquently about how shame, embarrassment, guilt, and the fear of not being believed weighed into the decision to seek or not seek services. We need to identify ways to begin to shift that reality for crime victims to increase that connection to services. Nonviolent crime victims also spoke eloquently and candidly about their victimizations. Although nonviolent crime is a different victimization experience, the need for services is significant, and a significant gap. There is a significant gap in available services for this population. This is an opportunity to explore how to better support and assist victims of nonviolent crime, perhaps through a combination of supportive services and the availability of self-guided tools to assist victims of financial crime as they navigate the complex entities that can be involved following identity theft or credit card fraud. But there is good news. The good news is that when victims are connected to services, they report that those services are effective. That was consistently attributed to the dedicated victim service professionals here in Connecticut that provide that assistance to victims of crime. If we can increase the awareness of services and begin to remove the barriers to engagement in services, we know that the outcomes are positive. That increase in services will require attention to available resources to allow for the provision of those services. Crime victims and crime victim service providers shared concerns about the current availability of resources and the impact of high caseloads and reporting requirements that they can have on direct service provision. As we embark on improving awareness of services and removing barriers to access, we need to be attentive to the increased level of resources required to provide quality victim services. Again, this baseline survey has provided us with a vast amount of data to continue to analyze. We hope that future victimization surveys will not only build on the categories of data captured through this effort, but will also allow for the exploration of specific areas of victimization to provide even more detailed information to best support specific victim populations. I'd like to add my thanks to the team at MDR and to everyone here for your support and collaboration throughout this project. I look forward to our continued collaboration as we move towards integration of the information we've gathered into our practices. Thanks so much.
And as to just close with that, Mary and I were chatting this morning, and we will reconvene this group or whoever wants to stay with us in January to give you updates of our progress, and for whoever's willing to volunteer to help us in the projects that we haven't even that will be coming part of the implementation plan. So we're hoping that you will stay with us through this process. And again, we're looking forward to having a meeting sometime after the holidays in early January. So Patrick, would you like to open it up for questions?
Absolutely. The floor is now open for questions. So. And I will just say that, again, this was a comprehensive needs assessment. So there's a lot of data that were collected as part of this process. We have what will ultimately be 4 separate reports, one detailing each component of the research process, as well as one comprehensive report that ties it all together. In addition, we're providing OVS with individual data tables that breaks out all of the results by various demographic, geographic groups, as well as the specific crime types that were experienced by respondents. So we really gave you what was a high-level view of the findings as part of this conversation today. But there's a lot here and a lot to dig in on. And hopefully, I think going forward, you'll have the opportunity to sort of dig into those specific pieces of what we provide, including we're providing the individual written transcriptions from the focus groups and the IDIs, as well as the actual data set and the individual de-identified data set from the survey results. So coming out of this, there's the opportunity, it's outside of this scope of this particular project, but again, some of the things that we've done on other projects like this is potentially producing things like infographics on specific topic areas, specific populations. That can all be done, I think, with the data that's coming out of this. So there's a great opportunity to continue to explore what we're looking at here and dig really deep on specific aspects of it. So that all will be there.
Okay, I see Miriam. Welcome. I see you have your hand up, which you have a question. And then after Miriam, we'll have Jessica.
Okay, thank you so much. Thanks for inviting me, Linda. This is so informative. And I know you've mentioned, just for those of you who don't know me, I'm Miriam Gohara. I teach at Yale Law School, and Linda has been a kind and frequent visitor in my class, which represents people who are either facing criminal prosecution or have been convicted of crime. So Linda's voice is a very important one for my students to consider, and she kindly included me in this meeting. My question is, and Patrick, you may have sort of already alluded to this, but will we have access to the data? Will we have a report? Will there be something that's publicly available that we can use as well in for our own research and information?
Yes, so the answer is yes. So we're working on a final sort of comprehensive report that, Linda, you can correct me if I'm wrong, but the intention is to release that publicly. And that's currently being wrapped up. I think we're in the final stages of our drafting of that. So I think that should be released very shortly. And even, I forget, it's quite comprehensive. It's not quite 100 pages long, but it has more data than we were able to present here in this particular presentation, as well as other deliverables that we're providing. So yeah, the intention is, again, we spent a lot of time and a lot of effort and a lot of hours collecting all of this really fantastic information from people who are kind enough to share it with us, and we really want to provide that back, and that's really an important part of the process.
Thanks so much.
Jessica?
So just want to say, thank you so much. This was so very interesting. I've been really excited about kind of hearing about the results of this, all the time and effort that's gone into it. But I'm especially happy and interested that a lot of this has been broken down as well as into location and geographic areas. For agencies who work across the state, it's going to be really informative and helpful for us to kind of see trends of where maybe things are working and where things aren't working, so that we could focus our attention more on those areas that where victims aren't feeling as though they're getting supportive resources. So I just wanted to say thank you for that. It'll be helpful for the work that we do at Survivors.
Oh, you're certainly welcome, Jess. I know there was a tremendous amount of, Patrick and his team provided a tremendous amount of information, and we were not able to provide slides ahead of time for kind of an easier consumption. So are there any other just general comments or questions?
And I'm assuming we can also provide this slide deck afterwards as well, for anyone
Yes.
who's interested in it.
Absolutely. Jessica, do you have another question, or is your hand still up? Thank you.
Sorry about that. I always forget to put my hand down in this one.
No worries. No worries.
And I was going to say, one of the things that I always like to share as well is that we're always open for if there's any additional questions that come up afterwards. Just because we're done with the presentation today doesn't mean we're not happy to follow up if there are any additional questions after this meeting. Again, we're always happy to answer any questions, facilitate use of the data if there's any way we can be helpful in sort of getting this out there and getting this used. That to us is a really great thing, and we're happy to do it.
Patrick, Rachel, you have a question?
I just had a comment that you gave us so much information. I think a lot of us are digesting it still. and if we could get back to you afterwards with any questions, but this was so informative. So thank you.
Thanks, Rachel. Kevin?
Yes, and this is again, okay, everyone, you did give us a lot to digest, and I appreciate all the work and effort that went into not only conducting it but summarizing all of these findings. So, and look forward to reading much more of the results and outputs along the way in the future. I had kind of one general question, and feel free to take this however you want, because you have a mix of both these qualitative interviews and focus groups along with the surveys. I guess I was wondering if there was any particular kind of sentiment or finding from the focus groups and interviews that kind of stood out in contrast to the sort of some of the survey results that stood out to you all as the researchers there, that surprised or kind of was an interesting counterpoint to what the quantitative side of the survey showed?
Sure, that's a good question, and I think one of the important aspects of a study like this is to combine both the quantitative and the qualitative research components, because ideally, oftentimes they complement each other. In the best case scenario, they complement each other, and you sort of get a richer story out of that. Occasionally, like you say, sometimes you sort of get conflicting results. I don't know, Allie, you may be able to speak more to that, but I think one of the things we deliberately did actually is we actually saw some of the early findings in the survey that were coming out of the survey, and then added questions to our interview guide for the focus groups and the IDIs to follow up more on that. So, for example, like the law enforcement issue sort of came up in the survey, and we ended up adding that specific question to the interviews to get more information about that. I would say one of the things that I think was mentioned briefly in here is that in the quantitative data, one of the things when you looked at satisfaction of services, mental health services were rated lower than some of the other services in terms of satisfaction. So those people who received mental health services were a little less satisfied overall than a lot of the other stuff going on. But in the IDI data that Allie presented, people had really tremendous things to say about the mental health services they received. So not necessarily contradictory, because I still think overall the rating was rather high on the quantitative data for mental health services, but a little bit, I think, of contrast there in terms of what we saw. But Allie or Cecilia, I don't know if you have anything to add to that.
Patrick, you said the exact point I was going to bring up about the mental health, and I did a lot of these interviews myself, so that was always surprising to me when I saw that in comparison with the actual survey results. I also just want to say I just love that we also did the focus groups in general to get this different perspective from the service providers, and how interesting it was to mirror what they were saying with victims of crime. So that was very special too with this whole project.
Yeah, and I would just say, I think it goes back when you look at the mental health issue. I think it just goes back to the finding that overall, people who do receive services in Connecticut are pretty highly satisfied with them overall. So I think that is a pretty key takeaway here, is that, again, there may be issues of access, of knowledge, of things like that, but if you can get, the people to the services, by and large, that is working pretty well.
We will send out to everyone the slide deck. It's a new phrase for me, so I'll be using it a lot. Thank you, MDR. But you should receive tomorrow an email, if not today, tomorrow, from Jean with the presentation. And please, if you have questions, or if you'd like to have questions or comments, you know how to reach us, and you know how to reach MDR. So this is just the beginning of this process. So, Judge, you're going to bring us home?
I am. First, thank you so much for that informative presentation, and I concur with the comments that we all have a lot of thinking to do, a lot of work to do, but this is, as Linda said, just the beginning. So thank you, everyone, for being here this afternoon, being a part of this, and for all of the hard work that went into this presentation. I think that will bring our meeting to a close. Hope that everyone has some time to enjoy this beautiful day. Take care, everybody.
Thank you, everyone. Take care.
Yes. Thank you so
Thank
much.
you.
Bye, thank you.